customers, our local community, and the environment. That's why we've made the commitment to power our store with Sonoma Clean Power's Evergreen electricity service. Just like the Mendonoma community, Evergreen is unique. It's the only service of its kind in California. It serves up 100% local renewable energy, 24 hours a day, 7 days a week. Visit Surf Market's website, surfsuper.com, to learn more about our commitment to clean, renewable energy and how you can help build the clean energy future by becoming an Evergreen customer. Local farmers, organic foods, renewable energy. Surf Market has been proud to serve our community since 1956.
Surf Market and Sonoma Clean Power, partners in clean energy.
Good morning and welcome to Peggy's Place on the first day of April 2021. And this is Leanne Lindsay, your host today, sitting in for Peggy Berryhill. We have a double header up today. We've got the Mendonoma Health Alliance with us, Heather Regelbrugge, as well as Joannne Gamble coming up in just a moment after a word about a few of the events that are happening in our area. And then on the second half of the hour, we have Silverman's Photography, and we're going to talk about their workshop that they're going to hold next week. And speaking of art, Jane Head is a Mendonoma Coast artist, and her show Heart and Soul is showing at Wallala Arts coming up this weekend, and there is a member preview tomorrow, April the 2nd, from 11 a.m. to 4 p.m. And then the opening is Saturday, April the 3rd, from 11 a.m. to 7 p.m. And the exhibit continues through May 3rd. And the good thing about this is that all the proceeds from all the purchases go from this exhibit to benefit RCMS and Wallala Arts. That is a wonderful, wonderful thing. And that's right here on the north end of town at Wallala Arts in the Redwoods. We have a notification from the city of Point Arena that they would like your input, whether or not there should be fireworks this 4th of July. And you can go to their website and take a questionnaire that they would like to have before their April 6th City Council meeting, and that's at pointarena.ca.gov. Thank you, Lisa from Lisa's Luscious, for giving us that notification. And one more thing that I wanted to mention is that there is a Zoom class that will be offered to those who would like to learn how to operate ham radios. And the Sonoma County Radio Amateurs Club is offering a 12-week online technician class amateur radio study course. And for more information about that, you want to see, let's see, you're going to go to, where do you go to register for it? Okay, well, here it is. Let's see. Well, I'm sorry about that, but it doesn't really show you where you're supposed to go, but you can probably Google Sonoma County Radio Amateurs Club. There is a telephone number here, so let me just read that for you. And that is 707-217-1017. That's 217-1017. And that goes from April 5th through the end of June, around June 21st. And that will do it for the announcements. I just want to let everybody know that today it is a gorgeous, beautiful, sunny day outside. It's 52 degrees, sunny again, and warm. It's going to get up to about 83 degrees here on the North Coast. And that's warm for all of us. And I would like to now welcome our first guest today, and that's Heather Regelbrugge and Joannne Gamble from the Mendonoma Health Alliance. Good morning, ladies.
Good morning, Leanne. How are you?
Good, good, good. It's going to be warm, that's for sure.
Yes, it's beautiful outside. Spring on the coast.
Spring on the coast. So why don't you guys, again, give a little bit of a summary, again, what Mendonoma Health Alliance does for our community.
Okay, well, we are a rural health network, and our founding partners are Redwood Coast Medical Services and Coast Life Support District and Santa Rosa Memorial Hospital. We have lots of programs that improve local access to wellness education, prevention services, and quality healthcare through creative collaboration in our community. So that's kind of our vision, mission. We have lots of different programs. We have a care transitions program that follows people from hospital to home. we have a care coordination program that just coordinates resources for people, whether it has to do with medical appointments or whether it has to do with food insecurity. We've been helped a lot of people through our crazy COVID stuff here on the coast. And we also have a rural health, we have a opioid grant. So we've got 2 large grants going on, and working with people who are experiencing substance use disorder, which is what we really want to spend a little time focusing on with you today. But really quick, before we get into that, we do have another cooking demonstration coming up on April 7th.
Oh, I love these.
Right, with Jill. I know that you really like that last one with Jill Newsonow, who's a registered dietitian, and she focuses on cooking for people with who are experiencing diabetes, high cholesterol, high blood pressure. So she does some really healthy cooking. So you can find that on our YouTube, as well as on the 7th. Go to our website, mendonomahealth.org, and look up for that Zoom link. So again, that's April 7th from 5:30 to 7.
And since you mentioned YouTube, I wanted to let our listeners know along the coast here and around the world listening in on the stream at kgua.org or any of the radio apps that carry us, that we are also live on YouTube right now. So if you'd like to log in, go to YouTube and just search for KGUA, the first 3 letters of Walala, GUA, so KGUA, and you'll see us on YouTube as well. And so let's now talk a little bit about the program that you were just referring to, the one about help for substance abuse.
Yeah, so I'm going to let Joannne start. She's got some great information to kind of start us off, and then we'll both just kind of trade off.
Sure. So kind of to lay the foundation for some of our work, I just wanted to touch on why we're doing it. As Heather mentioned, we have a grant through, it's a federal grant. It's called the Rural Communities Opioid Response Program Grant. And it serves to help increase access to care, treatment, and recovery in our area. As you know, and our listeners know, that it's a very, we live in a very rural, isolated community. Not a lot of resources, general resources and resources for addiction treatment and recovery. What we're hoping to do is to form a peer support program. And we want to do that because data we've gathered over the years tells us that in 2016, Point Arena had the highest opioid-related death rate in Mendocino County and in the state of California.
Really?
In 2019, it was Walala that had the highest opioid-related death rate in the state and the county. We also, in 2019, we did a community needs assessment around addiction and substance use, and found that 12% of our population here suffers from some sort of addiction. So that equates to about 690 people. And that was off of that, the census at the time. So
And
our
that was
population
even before this past year, which
yes, and
it
has definitely increased over the last year.
Mm-hmm.
So that's really also in that needs assessment, people were saying, we really just don't have, there's a little bit of support out there as far as peers go, but we really need more. So that's something that we want to try to focus on and improve access to in our community.
Speaking of this past year, what have you guys seen in this area as well as other areas 1 year later, where we're at now compared to what we've been through? What would you say that some of the challenges have been and how you've addressed those things?
Well, I think some of the challenges have been because of the isolation, because of people not being able to work. Substance use disorder has obviously increased, but we don't hear about it necessarily because people are so isolated, and because our mental health services are because we're so rural and we're considered frontier medicine out here. There's RCMS has 2 licensed clinical social workers, 2 for a very large area. And so the ability to sit down and talk to a mental health professional is more difficult in this time. There are telehealth options out there, but some people don't know about those telehealth options. or have the bandwidth to be able to do that from their home. So we have seen more people struggling with substance use disorder, with just mental health issues in our little area, which is really what Joanne was saying is the reason that we'd like to try to bring this peer support recovery program to the area, so that there's another option, so that people, like right now it's difficult to get in to see Jesse Manis, who's one of the LCSWs at RCMS. There's a lot of people who want to talk to her. So this would provide another opportunity for people to be able to express what they have going on, to talk to people who have lived experience. Yeah,
So there's someone out there listening right now that may feel that they're at that point where they would like to reach out and get help.
Mhm.
What's the first step that they do?
Go ahead, Joanne.
Well, they have a couple options. One option is absolutely to call Mendonoma Health Alliance. We have been working with trying to connect people with resources that we know are available. They're absolutely welcome to call us at or email us. I'll just say our number out there. So we're at 707-412-3176, and they can contact any extension. The main extension is 102. Heather is 103, and I'm at 107. I just lost my train of thought right in the middle of all that.
You were gonna-
or you can email us as well at
Thank you.
info@mendonomahealth.org.
Okay,
That
say
was
that.
the other part.
Right. Say that email address one more time.
info@mendonomahealth.org, and that will get you to our network coordinator, and she will let one of the community health workers know, and we can sit down and work with you. We have a space I'm sitting in right now, and we have iPads and computers so that we can help you get onto a telehealth platform to receive services if you need that. We can be an access point for that.
Because there are a number of people here in our community who are either technically challenged or digitally challenged, no internet, or whatever the case may be. You
Certainly.
provide that extra bit of assistance there.
Yeah, absolutely. With this program that we're trying to develop, one of the things that we're doing right now is, and tell me if I'm jumping the gun, Joanne, is we are trying to figure out how to develop a peer support recovery, right? Because it's not something we've done before. And so we are interviewing, we're asking people to spend about an hour talking to us, and they're from 4 different categories. So we're looking for people who are currently experiencing addiction, and it can be any type of substance, right? And we're looking for people who are who are well into their recovery. And we're also looking to talk to people who are loved ones or family members of someone who's experiencing addiction, and then also professionals and providers who work within that realm. So we had a great interview yesterday with a gentleman, and it just it excited me so much about our program. He was someone who was deep into his recovery and working with people as a peer in a peer support program, not in our area, but he says some really amazing things. One of the things that we asked him is, what does recovery mean? What does that mean to you? And the one word he said was balance. Balance. That's what recovery means to me. And he also said something that really struck me. And he said, when I got into a peer support program, there was a wall of bricks in front of me. And as I continued the program, each brick, I was able to take bricks out until the wall was no longer there, just piece by piece. And it was so visual, and it was so enlightening to hear what he had to say about how he got well. So
Visualization is a great tool.
absolutely, it was very powerful. But I don't know, Joanne, if you want to talk a little bit more about the program and about what we're trying to do. Real quickly before I stop talking. Also, for your time, we are giving $50 Visa gift cards someone who would sit down and do that interview with us. And we can do that over the telephone. We can do that via Zoom, whatever makes you most comfortable. So, and again, if you're interested in doing that, you can reach out to those same phone numbers, the 412-3176, extension 102, or push any extension, that's fine. And or info@mendonomahealth.org. Just let us know you're interested in spending some time chatting with us about your lived experiences.
And if you're just tuning in, I'd like to remind our listeners, or let our listeners know, that you are hearing Heather Regelbrugge from the Mendonoma Health Alliance, along with Joannne Gamble, who are talking with us today about their programs and specifically about assistance for those dealing and coping with addictions and what help there is out there for you. And that also they're reaching out to the community to find those who can participate in the program of a peer support, those who have been going through recovery and could provide perhaps that peer support too. And this is KGUA in Wallala 88.3 FM. We are streaming around the world at kgua.org on apps of Radio Garden, and tune in. And we also are live on YouTube right now. I'm Leanne Lindsay, sitting in as host today for Peggy Berryhill, and we have a double header coming up next. I just want to let our listeners know that we've got Silverman's photography workshop coming up after we talk with these ladies from the Mendonoma Health Alliance. And I would just like to go back to Joannne, if you had something more to say to that, or if you'd like to address some of the other ways that you help the community with health services.
Well, I only have a little bit more to say about the program we're trying to develop. As Heather mentioned, we're doing interviews, and we're hoping from those interviews we can really make something that will be inclusive and accessible for our community members, because we are such a different dynamic here. So we're working with we actually have two grants that are helping us develop this program. And one of them in particular is the Catalyst program. And they really focus on program development and innovative strategies for rural communities and for communities, low income, minority, and immigrant populations. So I'm hoping that with everyone's help, we can create something to reach as many people as possible.
And those grants are not easy to come by. They take a lot of work. You guys worked hard on getting those grants, and they have come in. The money is available. And one of the ways that you can offer that incentive to participate by giving them that $50 gift certificate is because you guys have worked so hard to get those grants in.
Yeah,
so
absolutely.
kudos to you guys is what I'm saying.
Well, thank you.
And also, it also supports the food program that you have. I'd like for one of you to talk to our audience about that.
Sure. So when COVID happened over a year ago, we applied for some small grants specifically to help the community deal with the fact that people weren't working, that kids aren't in school, parents are home. And things are difficult. And things are still difficult. Things are getting better, but things are still difficult out there. So we were given about $15,000 from some from the community foundations of Mendocino, some from the Wallala Lions Club, and some from the Wallala Community Center. And we have been able to help people pay bills that they can't pay. We have been able to give people gift certificates to the grocery store. We do have access to the food bank on non-food bank days, so we're able to get people food that way. We don't want anyone out there to be hungry, so if you need a hand, and if there are bills that you just can't pay, we have up to $250 per household to help you pay bills. So, and then definitely help you put food on your table. So you can reach us again at that 412-3176 extension 103, and we can see what we can do to give you a hand. There's the internet, the CCC, Coastal Communities Connected program out there to help with internet for our area, and with all of our kids still distance learning. Of course, being able to talk to someone via the computer is imperative. So that's how the kids are doing school. here and around the United States. So there's money out there specifically for helping people connect to the internet, and that doesn't have to just be Further Reach. It can be Sky Fiber. If you have another, people up in Annapolis who don't have the connectivity, Further Reach hasn't figured out quite how to, though they're working as well as Sky Fiber and on getting something up in that direction for those families in Annapolis. But if you have something in Annapolis that's working for you, you still have a bill that you can't pay, we can help with that too.
That's tremendous support for our remote community, all of our communities
Absolutely.
on both sides of the bridge. So we would like to just find out going forward during this next year, how do you see things going forward with Mendonoma Health Alliance? Some of the things that you guys want to take on in addition to this program that you've got for those who are dealing and coping with addictions right now. What do you see going forward?
Well, we see some more prevention education happening in the schools. Joanne and I actually are just wrapping up our prevention ed in the middle school. We have one more session with them after school spring break. So we were able to focus on vaping and mental health and stress and alcohol with some high school students as well as some middle school students. And so we're hoping to bring that back in the fall and maybe actually be in the classrooms, maybe go up to Annapolis and Manchester when everybody opens back up and hit all the schools again with our prevention education. Our care transitions program continues, and hopefully with more elective surgeries being completed and people not quite so fearful to go to the hospitals, that program will amp back up. Again, that's our 30-day care transitions program, follows people from hospital to home. Our goal is to keep you out of the hospital by doing things like coordinating appointments for you, helping you with those discharge summaries that sometimes are a little confusing when you come home, all sorts of things you're supposed to do. Making sure that you have the medication that you need, any kind of durable medical equipment that you might need, picking up prescriptions for you if you can't get to the pharmacy, and which might be more difficult for people right now. I know we only had one pharmacy and that was difficult, and now again we have only one pharmacy in different
That's right.
and that's difficult too. That is difficult for our people who are on the north end, right? It's hard for them to get all the way to Walla to pick up those prescriptions. So and that's a 30-day program, but after those 30 days, if you still need a hand, then you become one of our care coordination clients, and we still are able to help you coordinate those services.
That's really good, because I did have an opportunity to speak with an ER nurse the other day last week, and she said that the numbers have gone way up for elective procedures as well as those showing up in the emergency room, because people are feeling more comfortable now about getting things fixed or attending to things that have been needing to be fixed for some time, or even someone falls on their gardening shears, they're out in the garden, and they feel more comfortable now going in to the ER. And so that follow-up is really critical, what you guys provide. And assistance. Right.
Absolutely. Yeah, it's important that we take care of ourselves. So however that looks for each one of us. And I know that's been a difficult thing to do in these times. I would like to remind everybody that we still need to be really careful out there. We still need to wear our masks and socially distance. And I know there's a lot of information coming down from the CDC about okay, I know we're all ready to get out there, but we still need to be aware of COVID. So here in Mendocino County, we've been very lucky. We're doing a really great job with our vaccinations. And so I know we feel pretty safe here in our little community, as we did probably at the very beginning of COVID as well. But there's lots of people coming in too. So
we do have a lot of travelers coming through, and numbers are going up in cities around the country.
Yes.
And it's just so important to remember to wash our hands and wear that mask. Sometimes we can't always socially distance, but we can always wash our hands and wear a mask.
Absolutely.
And it was interesting. I was listening to NPR this morning, just some of the interviews that they've done and results that they've seen with kids across the country, that the respiratory infections have gone way down this past year, just because of wearing a mask.
Right.
And I know
And-
this is the
and they're
healthiest
not-
I've been in a year.
Right. And they're not in school, right? So they don't have the germs for everybody else, right? So,
Right.
yeah, absolutely. One of the other things that we will kick back off this summer is our chronic care management program. We teach that living a healthy life with chronic conditions class. Stephanie, who is our Spanish speaking, our bilingual community health worker, will probably be back end of May, beginning of June. And so she and I are actually going to teach we're going to teach trainers to teach that class. So we have that coming up in June, and we'll let you know about that as time gets a little bit closer. So yeah, and then hopefully our Matter of Balance class hopefully we can start that again, that we haven't been able to do because we were unable to do a virtual platform for that class, but that's a very popular class. So hopefully in the fall or late fall, early winter, we'll be able to start that class again too.
And can you just say a range of what the chronic conditions might include?
Pretty much anything, from hypertension to diabetes to obesity to COPD. If you feel like
chronic pain.
Yeah, chronic pain. If you feel like you have a chronic condition, the class is just a really amazing program about goal setting, about chunking up your world into small pieces so that it doesn't feel quite so big and you can attain your goals.
That is one of the most important things to remember every day. It's not
Absolutely.
something that you achieve and everything's perfect after that. It's just every day remembering those basic things.
Absolutely.
And during this last minute and a half or so, did you guys want to restate again the program that you've got for those who are facing addiction right now?
I'm going to let Joannne do it. Yes.
What we would like, so we're trying to develop a peer support program in Wallala, and we really want to interview people to help us in that process. So we're looking for people who are currently experiencing addiction, people who are in long-term recovery, professionals in that industry, that could be counselors or medical providers, and loved ones of people either in recovery or currently experiencing addiction. We'd like to sit down with you for about an hour, and we're offering a $50 gift card as part of an incentive to do that. And if you would like to do that, we can be reached at 412-3176, extension 107, or by email at info@mendonomahealth.org.
Perfect.
Thank you both for joining us this morning. That is Joannne Gamble, and along with Heather Regelbrugge from the Mendonoma Health Alliance that works with RCMS, Coastal Seniors, and other organizations out there, I'm sure. Can you just quickly say which other organizations those are, Heather?
Well, our founding partners are Coast Life Support District, RCMS, and Santa Rosa Memorial Hospital, but we work with all of the organizations. Those are our founding partners, but we work with all organizations in our area, especially as it pertains to coordinating services for our community members.
So I highly recommend to everybody out there listening, if you are coping with an addiction of one sort or another, please do contact these folks at the Mendonoma Health Alliance through their telephone number. And again, that is 412-3176, extension 102, or email them at info@mendonomahealth.org. Is it?
Yep.
Yes.
Org. All right. Thank you for joining us on Peggy's Place this morning. And I hope you
Thank
guys
you.
have a lovely warm day today.
You too. Thank you so much, Liam.
Thank you, Leanne.
Take
All
care.
right. Take care, guys.
Bye-bye.
Bye. And that will do it for the first half of Peggy's Place. And we were live on